All right. Well, I'll go ahead. I'd love to introduce you, Lauren. So Lauren is with Metro Optics, and she's going to give an overview of some of the awesome offerings that Metro has. We'll have Brittany in the background in the Q&A area to be able to answer any questions, and then we'll have Steve Webb, the founder of Metro Optics, the owner of Metro Optics, with us as well. So we have all of the experts in the room to ask all of the questions and get all of the specialty lens knowledge. So Lauren, I will have you take it from here.
Thank you. I appreciate it, Dr. Serenzi. So welcome everyone. I know it's late on the East Coast, so we're going to do this in about 10 minutes. And then at the very end, if you stay tuned for a question, the first person who answers it correctly in the chat will win the Insight Scleral Lens diagnostic fit set. I don't know if you're able to see this here. No, my silly blurry, sorry. But you'll see it here in the presentation. So first, the presentation, my name is Lauren Sisler. I'm with Metro Optics. I'm the sales and marketing manager, and I'm in Houston. But for Metro Optics, we manufacture lenses and distribute all over the United States. So for keratoconus, we have a soft scleral and corneal GP lens option for you. So first, quickly, a few facts about the company. I don't know if you guys were here on the last one, but so the family Jim Webb founded the company in the Dallas Metroplex area, hence the name Metro Optics in 1973. So we're actually celebrating our 52nd anniversary last April. And so all of our lenses are made on site in a 12,000 square foot facility where we make about 2,600 soft lenses and 200 GP including scleral lenses every day. And then this is Jim Webb, around 1964. This is before all of the amazing technology that we have today. But the three options that you guys will be interested in are the Comfort Cone, that is our GP keratoconic aspheric lens. And then we have a Kerasoft Thin, which is our soft keratoconus lens. And then we have the Insight Scleral lens, which is what the raffle will be for in just a couple of minutes. And I'm going to touch base on each one of these. So our Comfort Cone is one of two lens designs that is FDA 510K that holds the FDA 510K design approval in the United States for the indication of keratoconus. So this is let me see, this is a lens that is great for keratoconus in all stages, and it's a corneal alignment fitting. So we can fit about 70 to 80% of our patients in our Comfort Cone Quick Fit system. It's a bracket fitting where, if you can see here on the front, this is the fitting guide, and then it comes with a Ratten filter, which we'll touch base. We'll see some images in just a moment, and the importance of using a Ratten filter when sending images to customer service and consultation. So this is actually a complimentary fit set. If you have an account with us, you can always just send us an email and we can get one of these to you. Now, if you want to do more involved set, or if you're doing a lot of keratoconus, seeing a lot of cones, we do have a more in-depth 17 lens diagnostic set as well. And then this is the fitting guide that shows you step by step how to select the initial lens, do the evaluation. And with that fit set, the complementary fit set, we always include a Ratten filter because, as you can see, the image without the filter versus the filter, you're just able to discern a lot more going on with the lens, with the sodium fluorescein. And so here's an example that you can find. This is a 64 diopter cone peak with 7 diopters of change in the periphery. And so we are able to fit this patient comfortably, successfully in the Comfort Cone. So they were able to fit this lens instead of going into a scleral lens. But right here, you'll see that the fluorescein profile of the Comfort Cone, you don't want to have any apical touch, and you don't have any edge or seal off here as well. And you can still see the pupil through the fluorescein right here when you're looking at it through the slit lamp. Oops, hold on one second. Here we are. And just a fun fact. So the Comfort Cone was created in 1998 and it received the 510(k) approval in 99. And then the next lens that we're going to talk about again. So it's great to have different options because not every keratoconus patient is going to fit into one lens. So we have an RGP for some patients, and then we have a Kerasoft Thin created in 2004, was launched in the US in 2012. So there are a few options, a couple of options for a soft keratoconic lens. And the Kerasoft then does come in the definitive silicone hydrogel, and it is like 0.2 millimeters. So it is very thin, has great DK for Contumac has the optimum materials, and it's like a 60 DK. So it's really important to optimize the corneal health ocular surface. And so that's our focus. We're always focused on what is the best for the patient, what are their visual demands. And then something that's great that you can just take the filter, and then you can kind of move the oculars to the side and take a photo with your phone and send that to consultation. So instead of having to explain what you're seeing, you can just send us an image. As you know, a picture is worth 1,000 words. So then if the GP isn't a good option for this patient, then another option you can look at is the Kerasoft Thin. And again, here, silicone hydrogel, 74% water, 60 DK, 3 to 6 month planned replacement. Here are the parameters. This is what the fit set looks like. And again, this lens is not going to be fit like your standard soft lens. And inside you'll see that they have it's more on corneal profile, and it has a really nice image to show you the different corneal conditions going on here. And then we can also, here we're just trying to touch base. We have more extensive training on fitting all of these lenses as well. And then we also have our Insight scleral lens. So as you can see here, there's the Prolate series and the Oblate series. There is a toric haptic for each lens. It is a 15.6 diameter, but it's a center distance. And you can incorporate up to 3 diopters of add into this lens. And so we always, for the Prolate, you're going to, if I haven't even seen like a topography, we were just going to say initially we'll start at a 5, but based on the information we have, you just follow the fitting guide and it'll tell you which lens to start with. And then just get a lens, just take a picture of that lens, do the evaluation, send it to consultation, and we'll go from there. And this is just kind of a picture of the lens, just so you can kind of see it up close. And again, if you're not really sure or uncomfortable or like newer to this, it's okay. Just get a lens onto the eye, take an image, tell them what you're seeing, and then they'll know exactly how to, steepen or flatten any of the meridians. And then again, we want you and your patient to be as successful as possible. So we do have a care kit that most doctors will just incorporate the cost of the kit's $30 into their fit set, into their scleral lens fitting. So it comes with a 10-day supply of scleral fill solution, a tangible clean multi-purpose solution, a mirror, the plungers, directions. There is a discount code inside the bag as well that if you use the code START, I can put this in the chat. It's just START. That will give your patients a 20% discount on their first order. And then all of our lenses are plasma treated, as you can see. This is just so the lens is the most pristine. Whenever the lens arrives at your office, you don't need to do anything to it, don't need to touch it, don't need to check it. It's ready to go on the eye. And then HydroPeg. So yeah, water-based polyethylene glycol. We love HydroPeg. It just really improves wettability, and if you have any issues with like SPK, here's kind of a great image to show that. But they have amazing education for practitioners and for patients as well on their website on tangiblesciences.com. And then if you go to our website, we do have, if you see here, there's a Find a Doctor. So we really want to do a good job. So a lot of times a keratoconus, if they get this diagnosis, they don't know where to go or what to do, or that even contact lens are an option for them. So we are trying to help them find you. So if you go to find a doctor on our website, you click on this tab. There, we are still filling in all of our accounts here, but they can put in their zip code and then make sure that they check, whatever mile radius they need, and then your practice can come up in the search. And so if you go to our website and you have an account and you want to be added, you can always just send an email to us if you're not on there, if anything needs to be adjusted. And then trying to be quick. So now that we ran through all of that, raffle time. So again, the first person to answer the question correctly in the chat box will be the winner. It does look like we have a chat question. Let's see. Well, let's do the raffle. So yeah, again, we'll ask the question and then get your chat box ready, and then we'll see who the winner is. Okay, and here we go. Question is, how many keratoconus lens options do you have with Metro Optics? And then Brittany will, ooh, okay, got lots of answers here. Brittany, who did you see?
I see Adelina.
Okay, congratulations. We will get your email address if you don't mind popping it in there for us, and we'll reach out to you and just get all of the details so that we can get your fit set too. And then are there a couple of other questions in the chat? Sorry, I'm having
No, I don't see anything else.
Okay. Well, thank you very much. We appreciate your time. And if you do have any questions, yep, correct answer 3, Carasoft Comfort Cone, Insight Scleral Lens. You're always welcome to email us at info@metro-optics.com. My email is laurenasisler@gmail.com. And otherwise, have a good night, and we'll be in touch.